Coming up.
So an old world blend essentially has organ meat in it.
We're making gut-friendly meatballs that are packed with extra nutrients thanks to holistic nutritionist Jamie Maitland. Then we'll explore some lesser-known parks in the Hollywood area and learn how our friends at Publix are making it even easier to get in some extra veggies. We'll also chat with a plethora of health experts ranging from regenerative medicine to vein health. All that and more is today on SoFlo Health. Sometimes you want a snack, not a whole meal. Maybe you want to take the bike instead of a car somewhere. And maybe you don't want to pack up everything for a big day at the park, but you still want to get outside for a little while. That's why the city of Hollywood has the Hollywood North Beach Pocket Parks. What the heck's a pocket park? We're at one right now. This is Hawksbill Park, and it's basically just a small park. And it's the perfect place for you to go get a little fishing in, maybe go for a walk, or just take a break for somewhere to have lunch, and then get back to the rest of your day. We're going to visit all 5 in just a bit, but first, watch this. Oh, and welcome to SoFlo Health. On recent episodes of SoFlo Health, we've had Jamie Maitland. She's the owner of the Office Health and the Office Gym. We had a delicious salad that you made so simple, and now it looks like one of people's favorite things.
We're getting a little more hearty here, guys.
Yes, we are.
Not a salad. We have homemade grass-fed, grass-finished meatballs with grass-fed, grass-finished ground beef, and we also have a grass-fed, grass-finished Old World blend with bison meat.
What is an Old World blend?
So an Old World blend essentially has organ meat in it. I know that sounds a little too Nat Geo for some people at home, but liver, just to give you an example, is one of the most nutrient-dense foods on the planet, and it's essentially nature's multivitamin. I guarantee you if you give that to your kids or your friend or whoever, just have them eat it, you'd be like, oh, these are great.
Yeah.
Don't tell them what's in it.
Great. That's often the meatball secret. It's just like,
exactly.
Does it taste good?
Don't ask,
Don't
okay?
ask.
This was 1 pound of the Old World blend of bison, and then 1 pound of ground beef. And if you're a hard no to this, just use 2 pounds of grass-fed, grass-finished ground beef.
Okay.
It's fine.
Yeah.
Then we're gonna add a half of a yellow onion. Now, particular, don't chop this, because if you chop it, it's not gonna have the moisture that it needs. So you can either grate this by hand, bless you if you do that, or you can use a blender. And then I also added like probably 3 cloves of garlic.
Right.
Shove it in the bowl. Add some fresh chopped parsley. I probably did about like a 1/4 cup. Then we're gonna make the mixture, which is gonna bind everything together. Now, because this is 21 Day Reset approved, we don't have your classic breadcrumbs in there. Half cup of water, about 4 tablespoons or so of tiger nut flour. If you don't have tiger nut flour, you can use cassava flour. Then we have psyllium husk, and if you don't know anything about psyllium husk, it's an amazing binder, and psyllium husk is actually an herb.
And it's also a common fiber supplement for a lot of people.
Great fiber supplement. Some people put it in water. I mean, again, bless you if you want to do that, but you can also eat it. See, you're getting fiber and minerals and all the things. This is actually ground flaxseed. Coconut aminos, and if you haven't had these, they're very similar to soy sauce, but without the high amounts of sodium. 1 corn and soy-free egg, pasture raised. Thank you, Southwest Ranches Farmers Market.
Nice.
And then you're just gonna kind of whisk all this together. We're gonna combine both worlds here. And you just get in there and you just kind of start mixing everything. You don't want to like really over mix because it can tenderize the meat.
And while you're mixing there, remind us, what is your 21-day reset?
21 days of no sugar, no dairy, no lectins, no gluten, no alcohol. And you got to get in at least 4 to 5 micro workouts and workouts.
All cleaned up. She added a little bit of olive oil.
This is not a melon ball. It's the one up from the melon ball. We'll say golf ball size.
The schmedium.
The schmedium. This is about the size of a large golf ball. And yeah, you just scoop it like so.
Let's get in here.
So, total side note, when you do make them, 2 ways. So I personally like outside a little crispy. So you're gonna bake these at 375 for like 35 to 40 minutes if you like that. If you want them a little more tender, 375 for like 25 to 30 minutes.
Got it. Here we go. Yeah, it's really good.
It's a good meatball.
And It's got liver
Right.
and all the stuff that I want to eat, but I don't like the idea of eating.
Tell me that you wouldn't know that that's in there.
I have no idea, other than when you told me.
Exactly.
And how can they find out a little more if they'd like to?
They can find out more if you visit theofficehealth.com, or just better yet, just follow me on Instagram at Jamie Maitland.
Great. Jamie, thank you so much.
You're welcome.
This is delicious.
Yay.
Our next pocket park is Camps Ridley. It's great for picnicking, fishing like the others, and all of these parks are dog friendly, so you can bring Fido if you want. But don't bring your cat in one of those bags that has a mesh that you can see through. Well, maybe you can if you want, if you like bringing your cat around in a backpack, but either way, enjoy a pocket park. We're back at SoFlo Health's new Hollywood location to learn about the process of treating venous insufficiency. What is venous insufficiency? Well, here's Dr. SoFlo to tell you more, and I'm gonna go find Roberto.
There's 360 degrees of circulation. The body has to kind of circulate all of the blood. It's the return part, which is known as the venous side, which we've actually just started to learn about, and particularly at the SoFlo Vein Institute, we take really serious, we find where the problems are, and we have lots of new ways of treating it.
I'm now joined by Roberto at SoFlo Health. Roberto, thanks for spending time with us today.
Thank you for having me.
Of course. So what do you do on a regular basis here?
I do all the ultrasounds and also assist Dr. SoFlo with the procedures. The patient will come in and we'll use this thermographic device adjunctively with ultrasound to be able to screen the patient and see if they're at risk for any venous insufficiency or any circulation problems.
For those that come in for venous insufficiency, what are the symptoms that they're experiencing?
Usually heaviness on the legs towards the end of the day, cramping, discoloration, veins that are actually bulging out of the skin.
I was experiencing some pain and some swelling around my ankle. They had me come in, do a minor procedure, and I was in and out in 30 minutes to an hour at the most.
I'm in a tree trimming company. I'm on my feet 12 hours a day. I'm walking, I'm up and down ladders, I'm in trucks. The best experience in the world. I come in, it doesn't take long. 1, 2, 3, I leave, I put my stocking on.
I was always very insecure, wearing shorts, skirts, because of my veins. But now, coming here, I take care of that. And now I'm more confident. I can wear skirts, shorts. Summertime, I'm feeling good.
And then what's the procedure like?
The procedure is very simple. It takes less than 15, 20 minutes. You can go right back to work. You're just gonna wear the compression stockings for the 48 hours and just go about and just stay active.
Great. Well, let's listen into Dr. SoFlo and see what else he has to say about venous insufficiency.
About half of us end up with this problem in varying degrees. We can very quickly diagnose it with the very simple imaging methods that we've talked about, and begin a treatment paradigm, which usually starts with just simple compression socks.
I think the name SoFlo Health speaks for itself. They are a great office, great staff.
To come here, this is like, it's family. You know, I come in from the front desk to everybody in here, the best, hands down.
Everybody's welcoming, everybody's nice, they're all knowledgeable. They walk you through everything, they make you feel comfortable. It's nice.
Well, clearly Dr. SoFlo knows plenty about the veins and how they work for all of us. Any parting words that you have, anything you'd like to add, or you think people should know about venous insufficiency or the experience that you guys have here?
Yeah, if you have any venous insufficiency, you should get it checked out as early as you can. Just come in for a quick screening and we'll do the ultrasound as well, just to make sure we subside those symptoms for you.
Great. Yeah, that's ultimately the idea, is like you said, to get people back to work and living their life.
Exactly, yeah.
Great. Well, Roberto, thank you so much for giving us some insight on what you do to take a look at the legs and help people out.
Thank you for having me.
You got it. Come right back to hear how regenerative medicine could help keep you from surgery and the life-saving work happening over at Sylvester Comprehensive Cancer Center when SoFlo Health returns.
Focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
At age 17, Ashley Fenema was diagnosed with chronic migraine.
You're in complete silence and it still hurts.
Dr. Tisha May Monteith, a neurologist and headache specialist at UHealth, says migraine is more than just head pain. It's a chronic brain disorder that affects all aspects of a person's life.
It's a multiphasic disorder. They may have cognitive impairment, they may have stiffness of the neck, they may have light sensitivity. Patients may experience avoidance of certain behaviors or activities because you're afraid you're going to get a migraine, missing someone's graduation or a family function, and these things over time really add up.
Dr. Monteith says because migraine is an invisible disorder, there's often stigma associated with it. Ashley credits the UHealth team for making her feel seen and heard for the first time and is now spreading a message of hope.
The hope lies in the fact that we are not alone.
Ashley, whose migraines were so bad she had to be hospitalized, is now raising awareness. Her new treatment plan includes an infusion which blocks a protein that triggers migraine.
It's a modifiable disorder. We can help improve your quality of life and get you back to doing the things that really matter.
Ashley is now back to living her life.
I'm so grateful and I love her so much.
Welcome back to SoFlo Health. I'm Hunter Franke, and we're at a pocket park. What's a pocket park, you ask? A pocket park is simply a small park. And this one's called Green Park, which is right across the street from the Meek, where we were on a previous episode of SoFlo Health. So if you want to say hi to Captain, he's right across the street. We were previously at Hawksbill and Kemp's Ridley. Next is Leatherback and Loggerhead. If you haven't noticed yet, there's a theme. They're all named after turtles. And now watch this.
Thanks, Hunter. We are here in the heart of Coral Gables at one of QC Kinetics' multiple locations, and we're going to learn a little bit more about regenerative medicine. Now, what is regenerative medicine? Let's go talk to Dr. Fernandez. As we promised, y'all, we are here with Dr. Fernandez at QC Kinetics. So thank you so much for letting us come in and talk to you today.
Thank you. Thank you for the time.
So I'm definitely eager to learn a little bit more. I know we've talked with you guys before, but for people that aren't aware of what regenerative medicine is, can you give a little insight into, what people can expect when they come to you?
So the main concept is by using your own body's ability to heal itself, we are able to get these growth factors and using it to regenerate tissue, also help with inflammation and pain.
What type of conditions are you guys able to treat?
So we treat all kind of orthopedic conditions, sports-related injuries, including meniscal tears, rotator cuff tears, but also more advanced conditions like osteoarthritis of the knee, the hip, the back. And we're trying to basically, for these patients, avoiding more serious surgeries, also avoiding medications, and without taking any downtime from their jobs, from their life, and they could get back in their life and have a better quality of life overall.
For people that do come in here and they want to take that next step in the process, what does that look like?
So we're going to ask you to bring any previous diagnostic studies or this that you might have, so we don't have to repeat those unnecessarily. We also have in-house diagnostic tools, so we'll be able to use those as well in order to personalize a whole program that fits your treatment, but also your goals.
Is it anybody can come in here, or is there a specific type of group? Do you guys treat athletes?
Yes, from high elite performance athletes all the way to the third generation.
And if people are wanting to learn more about y'all and anybody that's watching right now, where can they go to find more information?
So they could go to our website, or they could just call us to the number below, and we'll be happy to have you and design a program for you.
Well, it was amazing to learn a lot more about regenerative medicine, so thank you so much.
Thank you for coming.
Today's actually World Cancer Day, so we've stopped by Sylvester Comprehensive Cancer Center right here in downtown Miami. They're one of the world's leading research facilities for cancer research, and they treat so many patients. And we're about to meet with Dr. Stephen Neimer, who's going to tell us even more about it. So let's go meet the doctor. This is Dr. Neimer. Thank you for spending some time with us today, Dr. Neimer.
Thank you so much for being here.
Of course. In your decades of experience, what have you seen change in the landscape of cancer research?
We've become much more precise. We have much more effective therapies. For the first time in history, people with a diagnosis of a serious cancer will live for more than 5 years on average. And so everyone thought cancer is a death sentence. We're now curing previously incurable cancers, and many people are surviving.
And cancer is always something that's a scary experience, but hopefully with that in mind, that it becomes less daunting for people to go through and be more willing to go through these treatments that can be difficult.
Yeah, the treatments are much better. There's a lot of ways of detecting, MRIs and CAT scans and things. There's actually now blood tests that are being developed that will allow you to find cancer at its earliest stage, because for almost all cancers, if they're found early enough, they can be cured.
People are at this point now more used to blood tests, especially since COVID. Testing in general has become much more to the awareness of the public, so that would be incredible for that to be able to take place. Is there anything else you'd like to share, Doctor?
Yeah, I think, it's World Cancer Day, and I think there's a lot of information out there for people. So if you're diagnosed with cancer, you don't have to feel like you're fighting this alone. Reach out to people. There's so many families who've had to deal with cancer. There's so many advances. And if you are told something that's very disturbing to you, always to get a second opinion. The other thing about World Cancer Day is there's a lot we can do to keep ourselves healthy and to avoid cancer in the first place. And so I think that's an important message. Sunscreen, you can never use too much of that, and not to smoke cigarettes and to maintain a lean body weight.
Wonderful. Thank you so much.
Thank you.
Fresh prepared veggie options to save you time and important information about epilepsy is after the break on SoFlo Health. Welcome back to SoFlo Health. I'm Hunter Franke, and this is Hollywood North Beach Park. There are 5 pocket parks here, and this is the 4th we've been to today, which is Leatherback. We've also been to Green, Kemps Ridley, and Hawksbill. Loggerhead is currently under construction, but we still have one last stop for you. They're all along the Intercoastal Waterway if you want to take a visit. First, watch this. Lindsay, it's so good to see you again.
Yes, you too. So glad you're here.
Oh, thanks. We're always happy to be in Publix. It's a pleasure to be here.
Awesome.
Every time. I've got some goodies here, and before we get into what's in here, what section are we in right now?
We are in our produce section where we have some already cut up produce items for our customers.
Yeah, I think I see some of that in here. Tell me, why am I holding these particular items?
Well, I made sure I filled your cart with things that you will really need. So This is the squash and asparagus, and they're so simple. You just pop them in the air fryer, oven, even microwave, if that's your preference. Portion size, easy, quick for your family, whatever your needs are. And we have 4 different options.
Perfect. What else is in here?
Well, we also have another way to just finish your recipe out quickly. We offer different diced vegetables. So quick, easy, whatever you need on the go. And then my personal favorite that I have to show, I put it in your cart for you. These are our wellness shots, our brand new wellness shots. This one's the energy shot, give you a little boost at the end of the day that you might need. We have different flavors. We also have, I stuck this in there in case you need it, a Be Well. So Be Well option. All these different neat little wellness shots you can pick up in your store.
That's great. So you're making it easier and easier for people to stay healthy.
We meet our customers where they are. We know they're on this wellness journey, and we want to go on it with you. Come on into your local Publix. Come check out your Publix or go on Publix.com and see what we have to offer at your Publix.
Great. Well, Lindsay, thank you so much.
Thank you. Thank you. And enjoy your vegetables.
Yeah, I was going to say, I got to go check out. So, see you in a bit. This is the main area of Hollywood North Beach Park, which has plenty of benches for barbecuing, picnicking, and it's close access to the beach. And across the street is Loggerhead Park, which is one of the other 5 pocket parks, but like I said earlier, it's under construction. The boardwalk is over here, so I'll see you after you watch this. Behind me is the Baptist Health Miami Neuroscience Institute, and I have some questions about epilepsy and seizures. We're here to meet Dr. Tornes, who's going to tell us the difference and talk about how they relate to each other. He's waiting for us right over there, so let's go meet him. Dr. Tornes, thanks for spending some time with us today. We're talking about epilepsy and seizures. Are they the same thing?
So they're actually not the same thing. So just because you have seizures doesn't necessarily mean you have epilepsy. And I think that's kind of a common misconception that people have. So people who have epilepsy have seizures, and that's what the diagnosis of epilepsy is. It's the recurrence of seizures. So people can have seizures sometimes, and it can be for many reasons, not necessarily that they have epilepsy. Sometimes if you have diabetes and your blood sugar drops too low because you gave yourself too much insulin, you can have a seizure. But that doesn't necessarily mean you have epilepsy. So there is a distinction between the two.
Can I have an epileptic seizure and not have epilepsy?
Yes. So usually the term when we say epileptic seizure, it's coming from your brain, and it's abnormal electrical activity, kind of overfiring of your brain, and that's causing you to have a seizure. Because people can have non-epileptic seizures, which usually are really not coming from your brain, necessarily from overfiring. And you could have an epileptic seizure but not have epilepsy, and that could be the same as you have a provoked seizure, which could be done by sometimes overdosing on medications, withdrawing from medications, having low glucose. So there's many causes that you can have a seizure, but that doesn't necessarily mean you're going to have the recurrence of seizures, which is what we kind of give you the diagnosis of epilepsy.
How would I know to see a medical professional like yourself?
If you're having seizures where you're not aware of it, those are sometimes really hard to tell. Obviously, if you have a seizure where it is noted and you come into the emergency room or you go to a physician, usually a workup is done at that time to see what is your risk of having further seizures down the road. And that's kind of when we start doing all our tests to figure out why did you have the seizure and do you have a risk of recurrence of seizures. And then that's when we determine if you do have a risk of recurrence that you have epilepsy and we start you on medications.
All right, well, thanks so much for the clarity. If people have some more questions or would like to find out more, how can they?
So they can go and look at our website or our phone number and give us a call for any information.
Well, Dr. Tornes, thank you so much. I learned a lot.
My pleasure.
You got it. Welcome back to SoFlo Health. I'm Hunter Frankie. We're continuing our tour through Hollywood North Beach Park. We visited our 5 pocket parks, and now that we're at the main part, it's the most fun and what you probably think of when you think of Hollywood Beach, and that's the Broad Walk. The Broad Walk is just behind me, and it's a broad walk, not a boardwalk. It is a broad walk. And if I turn myself this way, you can take your bike, your rollerblades, your skateboard, whatever you want, and you can just keep riding that way. And of course, everyone's favorite part about being here, the beach. In fact, a little tip for those of you that don't like crowded beaches, if you go just a little bit north of Hollywood Beach, as you can see, there's not many people here at all. And this is the summertime when people are out enjoying the beach. Well, that's all we have for this week's episode of SoFlo Health. Thank you so much for watching. As always, you can watch previous episodes of SoFlo Health using SoFloShows.com. You can also follow us using @SoFlo Health to share with us what you're doing to stay healthy. Until next week, it's goodbye, good health, and good grief. Does this plane have to ruin my shot? Join us for a pregame visit to Lone Depot Park to check out their new food options and meet the first Sports Illustrated swimsuit model with alopecia to hear her story and how she's helping others experiencing the same condition.